Hello, I am Dr. Gurdev Saini, Clinical Director for Havering Clinical Commissioning Group and Chair of the BHR CCG Intermediate Care Steering Group. The team leading the proposed changes to intermediate care services across Barking and Dagenham, Havering and Redbridge. I'm sorry I can't be with you at the meeting. I'm currently overseas, but I was determined to join you today to talk about our plans to make intermediate care better for local people. As a GP, I know that my patients don't want to go to hospital unless they really have to. If they do need a spell in the hospital, then they want to come home again as soon as possible. That is just common sense. We know people recover better and more quickly in familiar surroundings close to their families, as long as they have the right care and support from health and social care services, nurses, physios and so on. This is what our proposals are all about and why we are here today. We want to permanently establish the home-based services we are currently trialling and have one community rehabilitation unit on the King George's Hospital site. In the past, we haven't been providing patients with this sort of care. Too many people spend too long in hospital with all the associated problems, increased loss of independence, loss of mobility, and potentially other infections that we know can be a problem in hospital settings. We want better care for our patients, so we looked at what other places are doing, both here in UK and overseas, and at how doing things differently can help people recover more quickly. To make sure that changing the way we care for people would really work for our patient, we decided to set up a trial to see for ourselves and to talk to patients and carers and ask what they thought. We have been trialing two new community services, the community treatment team and the intensive rehab team, helping people to get care in their own homes and to avoid having to go to hospital where that is appropriate. Anybody who does need a stay in a rehab bed is still able to get that care, and even under our proposal, anyone who needs one of these beds will still be able to get one. That won't change. The new services have proved a big hit with the patients. We have surveyed patients and their carers during the trial, and they have consistently rated the services 9 out of 10. So far during the trial, we have cared for more than 10,000 patients. 10,000. If we had just had the old bed-based service alone, that number would be around 1,300. Far few patients in a bed, not recovering as quickly or as well as they might. Those patients who do still need a bed care are getting one, as I said, and getting it quicker, less than 2 days wait now compared with 5 days previously. And people needing the community treatment team service are being seen within 2 hours. Not only that, but 9 out of 10 of those people seen by the community treatment team do not then need to be admitted to hospital. Because we are now caring for more patients in their own homes, we have unused rehab beds in our 3 units at Grace Court in Barking and Dagenham, Foxglove Ward at King George's Hospital, and at Harenwood and Galleon, also in Redbridge. That doesn't make any sense. We believe merging the 3 units into one at King George's Hospital will result in better care, help people recover more quickly, and mean we can redirect those currently unused resources into other services and care for local people. We propose having between 40 and 61 beds available at King George, according to demand. And we have carefully modeled the number of beds on how many beds are being used now. Under our proposals, there would be no changes during this winter. We currently have 104 rehab beds in the system on 3 sites. From July to September of this year, we used an average of just 55 of those beds. As trial has become established, the number of beds we are using for rehab has fallen as we expected. Following a period of engagement with patient groups and local authorities at the end of last year, the 3 CCG launched a 12-week public consultation on our proposal at the start of July. The documents, which were developed with the help of some of our patient reps, were distributed to all GP surgeries, libraries, councils, one-stop shops, and by local community groups to their members. We also sent them electronically to our stakeholders with links to all documents, including the questionnaire online. More than 1,000 questionnaires were downloaded. We held drop-in sessions and we offered to go to and talk to community groups and met with a diverse set of groups across the 3 boroughs. On top of this, we had a large amount of local media coverage, all of which helped us get the message out that we wanted to hear people's views. The consultation was extended by another 2 weeks following a request from some residents and stakeholders and ended on the 15th of October. Not everybody agrees with our proposals, of course. Some people who live near to the existing units in Wanstead are less enthusiastic about seeing those beds moved to King George's Hospital, despite the beds remaining in the borough. We haven't seen that level of opposition in other parts of Redbridge, nor in the other 2 boroughs. People here seem largely persuaded that the care that people get is more of a priority than the buildings they are cared for in. And of course, under our proposal, more people would be cared for in their own homes in any case, without needing to travel to King George's at all. We distributed 5,400 consultation documents and received 438 completed responses, including 25 responses as letters. The responses came from a very wide range of people and organizations: patients, carers, doctors, hospitals, members of the public, community groups, health watch, MPs, local councils, and professional bodies such as the Charter Society of Physiotherapy. We have spent the past few weeks going through all those responses carefully and compiling the report you have before you today. It is not the only thing you will consider ahead of your decision. You have your own knowledge of the services and all the detail in the business cases. But I'm sure you will agree it is an important part of the overall picture. So what do the consultation responses tell us? There is a strong support overall and in each borough for permanently establish the new home-based services. There is a support overall in each borough for our preferred option, home-based services where possible, and 1 community rehabilitation unit on King George's Hospital site. There is a support overall and in each borough for reducing the number of community rehabilitation beds, which range from 73% in Barking and Dagenham to 54% in Redbridge. There is a support overall, though from just under half of the respondents, and in Barking and Dagenham 64% and Havering 56%, for reducing the number of community rehabilitation units. In Redbridge, more people oppose reducing number of community rehabilitation units, 48%, and then supported it, 36%, although that opposition was still slightly below half. As well as being chair of the steering group, I'm also a practicing GP in Collier Road. The response to the consultation in Havering is interesting, given that all our intermediate care beds moved from Havering to King George Hospital in late 2012 because we had Legionella at the St. George's Hospital site. Havering respondents were in favour of each of our proposals. Havering respondents were more positive about all the proposal than respondents overall. Havering respondents showed more support for permanently running the new home-based services with just under 9 out of 10 people in favour. Havering respondents showed least support for reducing the number of community rehabilitation beds, but over half were still in favour of doing so. Almost 3/4 of Havering respondents were in favour of preferred option. As chair of the steering group, I believe our consultation was robust and has demonstrated that overall people agree with us that the new services should be established and that one centralised rehab unit at King George's Hospital makes sense, both clinically and in terms of using our valuable NHS resources appropriately. Even in Redbridge, where we had the most opposition to reducing the number of units from 3 to 1, the majority of respondents agreed that we should reduce the number of beds as they are not being used. It is important to remember that this is all about improving care for our patients and maintaining people's independence as much as possible. Better care in the right place, mainly at home, with better access and better outcomes. And for those patients who do still need a bed, they will get one. And they will get into it more quickly and spend less time in it. That's a good thing. But now, enough from me. My colleagues on the steering group from Redbridge and from Barking and Dagenham will give you their thoughts on the work we have been doing to make intermediate care better for our patient on improved access, patient satisfaction, improved outcome, and on the clinical case for centralisation. But before I do that, I would like to thank all members of the steering group for their hard work. Thank you for listening.